All right. Hello, everyone, and welcome to tonight's Public Health Genetics and Genomics Week webinar. Tonight, I've got a panel of public health genetics students with me who are going to be talking about what's in a degree, education and career path with Pitt Public Health Genetics students. And so we're going to start with some introductions. So my name is Dr. Andrea Durst, and it's my pleasure to be moderating the panel tonight. I'm going to do a short introduction of myself and then turn it over to the students for a brief introduction of themselves and then of public health genetics. And then we will open it to questions from you all in our audience. You're welcome to participate by submitting your questions for the students via the chat, and we'll be answering those live during the panel tonight. And so with that, let's go ahead and get started. So again, my name is Dr. Andrea Durst, and I'm an assistant professor in the Department of Human Genetics in the School of Public Health at the University of Pittsburgh. I'm director of the MPH in Public Health Genetics program and also associate director of the Genetic Counseling program here at Pitt, where I have the pleasure of teaching and mentoring the amazing students and recent grads on the panel today. In addition to my roles at Pitt, I'm also involved in a number of public health genetics related projects, including the NIMAC Regional Genetics Network, as a member of the leadership team for the APHA Genomics Forum, and with the PA Cancer Coalition's Cancer Genetics and Genomics Work Group. So that's a little bit about me, and now I'm going to turn it over to our student panelists to introduce themselves. So Kit, let's go ahead and start with you.
So my name is Kit Church. I go by she, her pronouns, and I recently graduated with my MPH in public health genetics in December of last year. I was really drawn to public health genetics and genomics because I had a background in, working with mental health and developmentally disabled individuals, and also had a background in genetics research, and I really wanted to combine these two. And I honestly didn't know about public health until I, started looking into public health genetics. I was like, oh, that's the perfect thing for me. At the moment, I am working as a research coordinator for a ultra rare disease advocacy group known as the TBRS community. And just enjoy participating in things like this to spread awareness about public health genetics. So Vivian.
Hi everyone, my name is Vivian. I just finished I use she, her pronouns, and I just finished my first year in the MPH program at Pitt. And kind of what drew me to this program was I've always really loved genetics. I always thought it was just like super cool and really interesting, but I didn't really become that interested in public health until the pandemic happened, is when I really first found out about public health and just how important it is to ensuring just like that everyone is safe and healthy. And so this program was a really great program for me because it really combined both my interest in public health as well as in genetics. I'm currently interning with a rare disease advocacy organization for Edwards syndrome or trisomy 18 called the EWE Foundation. And yeah, I'm really enjoying it so far, and I hope to use my experience here in my MPH to pursue something in like rare disease advocacy and specifically in like neurodevelopmental genetics. So Carmen.
Hi, everyone. My name's Carmen. I use she, her pronouns, and I've also just finished my first year at Pitt in the MPH program. I got interested in public health genetics mostly because I really like the idea that you can look at genetics and genomics from a much larger scale and kind of at a community level, as opposed to just a clinical level, which a lot of like genetics training programs and med school routes tend to focus on right now. So this program was really exciting to me because it's a little bit broader, and I feel like I could make a broader impact, which brings me to my career goals. I really want to work on health equity and genetic literacy for both the general population, but especially providers, to kind of provide genetic literacy trainings for people who might have gone to school for their professional degrees a while ago, or even like 10 years ago, when genetics and genetic testing was much, much different than it is right now. So just kind of hopefully getting into continuing education type of things.
I am Kennedy Sawicki. I am also a first year, or just finished my first year at Pitt. I use she, her pronouns. I have always loved genetics. My undergraduate degree was in genetics and genomics, so I knew I wanted to do something in genetics. And I also took a public health class in my undergrad as well, and just kind of found a passion for that. And this was the perfect program to kind of combine those two passions of mine. So I'm really excited. I'm loving it so far. It's been great. And I've really learned through this program that I love genetics education and genetic screening and things like that. So I hope to go into that in the future after I graduate, specifically maybe like newborn screening and education around newborn screening.
Hi, my name is Rochelle Maitoto. I use she, her pronouns. I also just completed my first year in the Human Genetics MPH program here at Pitt. I chose public health genetics because I was interested in further understanding the connection between genetic conditions and outreach and education. So I'm currently working as a health unit coordinator in an inpatient neurology unit, and I'm also working in a genetics lab studying a neurodegenerative disease called autosomal dominant leukodystrophy. So I'm currently interested in pursuing a PhD in genetics, and in my future career, I hope to incorporate and participate in community education in addition to laboratory discoveries.
Okay, so before we go into kind of questions that you might have about like what we're doing as public health genetics students, we kind of wanted to give an overview of first, like what is public health genetics? And so essentially, public health genetics and genomics applies genetic and genomic information to improve public health and prevent disease. And it does this through a number of different ways. So for example, we can use public health genetics to identify genetic risk factors to increase opportunities for early intervention. We can also use it to educate providers and patients, as well as families and the general population on genetics and concepts in genetics, such as family health history, and then also engaging community leaders when developing genetics policies.
There's a couple other ways that we can use public health genetics and genomics as well, including providing genetic services, one of which you might have heard of, newborn screening, which is done in every state on every newborn, as well as different types of screening like cascade screening, that kind of thing. Help to guide laws and regulations on genetics as they're being used more commonly in medicine and many different fields. And we can use public health genetics and genomics to consider the social, ethical, and legal issues in regards to integrating these genetics into public health programs.
So there's only a few education programs that are specific to public health genetics and genomics in the country, one of which is Pitt. And here at Pitt, we have an MPH in public health genetics, which also is a part of the dual degree track for the genetic counseling program here at Pitt. So some students have the opportunity to pursue both of those degrees at the same time, which is a really unique thing about this program. The other MPH in public health genetics program in the US is at the University of Washington. And then the University of South Florida also offers a MSPH in genomics at their School of Public Health.
Okay, along with MPH in public health genetics, there's also a few schools that have certificate programs in public health genetics. So Pitt does offer certificates if you don't want to do the full MPH. there is the certificate option as well. There you can do the certificate as just by itself, or you can, be in a different department in the School of Public Health at Pitt and pursue the certificate in public health genetics, which I think is really incredible. So, there's few required classes and then a bunch of electives to finish out the certificate, which is really great. The University of Michigan School of Public Health also has a certificate in public health genetics, as well as the University of Washington. And then the University of South Florida has a certificate in genomics.
So here's a list of some of the careers that you may be able to pursue after you get your degree or certificate in public health genetics, some of which include bioethics, data analytics, genetic policy and advocacy, program evaluation, public health research, and science communication. Beauty of public health genetics, it really is a choose your own adventure. You can be as broad or as specific as you want, and with the opportunity to have that public health degree under your belt and those skill sets, you can really, the world is your oyster.
Okay, and now I guess we can open the floor up for questions from our audience.
Right, excellent. Well, the first question that I have for you all as students and recent grads is, what made you choose to train to be a public health genetics professional? And you might have addressed this a little bit in your introductions, but if you wanted to go into some more detail here.
Yeah, absolutely. So I addressed a little bit that I, for a long time, worked in mental health services and developmental services and that kind of thing, but always really had a passion for genetics. As I was completing my BS in biology, I actually started looking into professions that might be related. And I, of course, first found genetic counseling. But then as I did some more research, and actually it was through finding the dual program at Pitt, I found public health genetics and looked into that and kind of realized how expansive that knowledge is, and how I guess kind of like malleable the degree is, like how many different things you can do as a professional in public health genetics and genomics. So that kind of led me this way. But
Thanks, Kit.
I guess for me, before entering Pitt, I was a research coordinator for clinical trials, and I knew what I wanted in my career was to maintain that. I do enjoy research quite a bit. I wanted to participate or incorporate neuroscience in some way, and in undergrad, I did only take one genetic class, but found a true love in that. So I really pursued, or I've was on the good old Google and found that there was opportunity to not only do community outreach, but research and genetics, which I found so fascinating, and that led me to finding out about Pitt.
For me, I think slightly similar to Kit, I also found genetic counseling first. And I was kind of pursuing that for a while, and then it just didn't work out. And I applied to Pitt's public health genetics MPH program. And I've kind of learned as like going through my first year that everything I wanted in genetic counseling, I can do in public health genetics. And it's become like a huge passion of mine. And I'm super excited to kind of see what happens. And I found this love for screening programs and educating on genetics, which is exactly what I wanted to do in genetic counseling. So I'm really excited and looking forward to my future in public health genetics and genomics.
Yeah, I kind of have a similar story also to Kennedy, but I found genetic counseling first, and I really thought that, I really liked that career, and that was going to be the career for me. But I really do think that the MPH program does have a lot of the things that I liked about genetic counseling. The biggest thing for me was that I really liked being a patient advocate, and especially with navigating like genetic care and genetic health systems, I feel like it can get really challenging for a lot of patients and families. And so that's why like I really like genetic counseling, but I found that I can kind of do something similar in like a patient advocacy role with public health genetics as well. And so that's why I chose to go down this path.
So my background is actually in neuroscience. And for my undergrad, I wrote my thesis on like some public health interventions, which looked at toxic stress in early childhood. And through my research for that, I discovered just how many things so early on can have such a strong impact on your health for your entire life. And that really got me interested into genetics again, because I think, like Chriselle said, I only took like one genetics class that was dedicated to genetics in my undergrad. But that got me really excited about looking at genetics as a potential graduate studies program. And I also applied to some genetic counseling programs and ended up getting into the MPH here at Pitt. And I really like the interdisciplinary nature of this degree, where you have the public health community outreach and interventions. But also you get like that cool sciencey genetics part, which I think is a huge draw of public health genetics and genomics for me.
And thank you everyone for your answers there. The next question we have from the audience is, where do you see, and this is a big one, where do you see the future of public health genetics in 5 years and then in 50 years?
Oh, I think that is a huge question, because the field of public health genetics and genomics has not even existed for 50 years yet. So, and the rate at which it's growing is just so rapid. Like the things that we can do today that we couldn't do 10 years ago, 20 years ago, we only first sequenced the human genome, and now we can do whole genome sequencing, whole exome sequencing for anybody for not cheap, but it's not $1 billion a person. So in 5 years, I think we'll really be seeing just like the expansion of genetic screening and genetic testing for more people. And I think it'll get cheaper and easier to do that. And I honestly couldn't even guess where we'd be in 50 years, but I hope that it would be with lots of screening programs and really efficient ways to look for genetic variants.
Yeah, I agree with you, Carmen, and I would hope, it's kind of hard to think, like you said, what would happen in 50 years. I do think that in 5 years, having these, we'll have like so much more genetic involvement in public health programs, through screenings and that kind of thing. But from a rare disease standpoint, and like the standpoint of many diseases that aren't included in lots of screening, I would hope that in 50 years, it kind of expands beyond that, so we can kind of detect diseases and that kind of thing, and any health problems like early on, because early intervention can be so important, these kinds of things. So it's really hard to say for sure, but I see public health genetics having a really bright future, and that's why it's so important for people to learn more about genetics and genomics also, so that they can understand things as they're more common in everyday life.
Yep, wonderful. All right, I know that was a big question. Thanks for tackling that one. We've had now several questions come through about job positions. So I know that you all talked about some potential careers in your slides, but perhaps maybe just repeating. So one question was, what sort of job positions does your program prepare students to go into? And what areas of public health do most students with an MPH genetics work in? And I can fill in too, but I'll let you all talk first.
Definitely. So being at the University of Portland, we have a good connection with the University of Portland Medical Center. So my current position, I'm in a health unit, I'm the health unit coordinator at an inpatient neurology unit. So there are a lot of opportunities through in hospital positions that we may be able to participate in that Pitt has a direct connection with. We also have, for me specifically, there are a lot of good opportunities to participate in laboratory work as well. Our Pitt faculty, they pretty much all have a lab that you may be able to participate in, that if you take a class with, you can see if there's something that you may be able to do and rotate into that laboratory and see what's going on and see if that's of interest to you.
Yeah, as a recent Pitt graduate, I can also tackle that a little bit. Kind of like to mention something that my husband said when I first decided to join this program, which was like, you know, when you're going for specific degrees, like a doctor, for instance, you know you're going to be a doctor. Whereas with public health genetics, there's such a wide range, which can be a little overwhelming at times career-wise, but at the same time, there's so many different things you can do. So like I know former graduates who are planning on going into research as far as lab research. I know graduates who are going into research, but not like wet lab type of research, more data analysis. I know individuals who are program managers and project managers at local public health departments and that kind of thing. And then of course I work with rare disease advocacy groups and hope to continue to work with advocacy groups like that. I know individuals going into policy. So there's just like a lot of different career paths, I guess, that can sprout off from this education.
Yes, and so the person who asked, you know, what area of public health do most students go into, or public health genetics do most students go into? There's really not like a most students, because it is so vast that students really are able to choose their own paths and, you know, start to kind of customize their education while here in the Pitt program towards some of those paths if they want to. So there are room for electives, for example, there's a practicum, there's a culminating project. And so you can oftentimes gear those toward a specific area if you know that that's something that you're interested in.
Yeah.
All right. Go
Oh,
ahead.
I was just gonna add, even like outside of coursework and your practicum, like there's a lot of really cool opportunities at Pitt to get involved in all different things. So like we have like the AFA Genomics Forum, as well as like the Pennsylvania Cancer Coalition that Dr. Durst talked about a little bit at the beginning. But students can certainly be involved in like organizations like that. And then there's also, of course, like NIMAC, the Regional Genetics Network, and they have events and stuff. And so there's a lot of things that you can do like outside of just coursework and practicum as well.
Great, thank you. So we've gotten a couple of questions now asking specifically what type of research you all have done while in the program, as well as what kind of practicums and internships you've had. So I know some of you have talked about those already, but for those of you who haven't, you know, if you wanted to talk about the kinds of hands-on experiences you're getting.
I can talk about mine because I don't think I mentioned it in my intro. So I am back home in Michigan for the summer. I grew up in Detroit area, and so I found a connection through a friend with a program called Kids Health Connections. They do a lot of like childhood health initiatives and stuff like that. So they have a program over the summer called Fit Kids on the Move, and I'm going to be helping them with that. It's the childhood obesity prevention. And then my preceptor for my internship is also on a work group for the Midwest Genetics Network. And the work group is working on an education program for genetics clinics and genetics providers about trauma-informed care in genetics clinics. And so I'm also doing stuff with that, and I'm going to write a literature review for them and come up with like a cost analysis fact sheet to give out to the public and to policymakers about why trauma-informed care in genetics is super important.
So I also don't think I mentioned my research that I'm doing right now in my intro. I'm doing clinical research right now at the Children's Hospital of Pittsburgh. And the study that I work on is a vaccine surveillance study that's sponsored by the CDC. And so what we're looking at is the germs that cause kids to get sick with respiratory and gastrointestinal illnesses, so that we can hopefully improve vaccine efficacy in the future. So we look at a bunch of different respiratory viruses, GI viruses, and take samples, enroll people and do surveys about their symptoms, so that we can just really better understand how kids are getting sick, what viruses are causing kids to get sick. And the CDC uses data from this study to help formulate the flu vaccine for like the following year. So if you know, like the flu vaccine changes from year to year, and they kind of try and predict which strain of influenza is going to be most prevalent in that flu season. And so this is one of the ways that they get that information so that they can make those vaccines to hopefully help as many kids as possible, which I really like this because with clinical research, you're getting to be in the room with patients, you get to be there in person. I'm not a wet lab person, but I really like the patient-facing roles. And so if you want to do research, but like me, you're like, I don't want to be at a bench all day just pipetting, which if that's your jam, that's awesome. But that's not the only options for research, and that's not the only options for research at Pitt. So yeah.
Yeah, no, like Pitt definitely has like a huge medical center for anyone interested in getting involved in clinical research. So I recently actually just transitioned out of my clinical research role for my summer internship, but for almost, I think like I started in like September, October, and like just transitioned out in April. I was doing clinical research at UPMC Hillman Cancer Center. I was working on a clinical trial funded by the NCI where we were trying to develop a pain intervention for breast cancer survivors who are experiencing persistent pain like 3+ months after their surgeries. And so we were trying to better understand some of their experiences with breast cancer surgery, and also just like some of those symptoms post-surgery. And so, yeah, kind of like Carmen, like I really enjoyed the patient-facing role. I really like talking to different breast cancer survivors about their experiences. And it's definitely like a really huge learning opportunity for me. And also kind of what motivated me to get involved in like the Pennsylvania Cancer Coalition as well. So just like, it was a really cool research opportunity, but it wasn't super genetics related, which is part of why like I transitioned out of that role. And so now I'm currently doing my practicum with a rare disease advocacy organization called the IWI Foundation. And so they're really dedicated to providing education and support for patients and families affected by Edwards syndrome or trisomy 18. And so something I'm going to be working on with them this summer is I'm going to be working on a health equity for rare diseases workshop and educational materials for patients and families. And I'm also going to be working on some newborn screening educational materials for when Newborn Screening Awareness Month comes in September. So, yeah.
Kind of similarly to Carmen, I am not a wet lab person either. I did it for a couple of years, not my jam. But so I was really interested in research that wasn't lab research. And I actually worked with Dr. Durst and another professor in the Pitt Public Health department, as well as a professor at Yale, on a project looking at ethical, legal, and social issues in genetic research with Pacific Islanders. So for my study, we looked at genetic literacy for this Pacific Islander population, specifically comparing genetic knowledge with like interest in participation in genetic research and that kind of thing. And it was a really exciting project to be a part of. So there are lots of different options for research. It's not just what you might think of from like, TV or that kind of thing.
And for my practicum, I'm actually not going to be doing it related to my lab work at UPMC in the inpatient neuro unit, where I'm trying to work it out with my preceptor to see if I can evaluate any interventions that they're doing. Specifically, we're looking at charting of nurses and the importance of that for continuity of care, and seeing how that has changed before the intervention that they've implemented and afterwards. So doing a little bit of data analysis on that, as well as setting up an educational board for the nurses and the doctors about various genetic conditions that some of the patients who are in the hospital, what just further information on that.
That's great. Thank you, everyone, for sharing. Now, you may have noticed that many of these students and recent grads talked about multiple experiences while in the program. And I find that that's pretty common. Even though there is one practicum requirement, students, at least here at Pitt, are not required to fulfill that in just one experience. So you might split up half the hours in one experience and half in the other. Some students also have work positions and or do something different for their culminating project for the program. And so really there is the opportunity to get many different types of experiences while in the program, if that's something that you're interested in as well. And we had a more specific question here, which I can tackle, but it was, where'd it go? I thought I had it pulled up here and then my screen keeps moving. Oh, you mentioned before you can go into genetic policy. What are some organizations out there, and what position would MPH Genetics have in these organizations? So I think that we tend to think about policy pretty broadly in public health genetics. So not just thinking about the creation of laws and bills, but policy at all kinds of different levels. So some positions that students have held include with the National Coordinating Center for the Regional Genetics Network. They do a number of different policy projects. We've had students work with our regional genetics networks on policy-based projects in the past. We've had students work with the Genetic Alliance, who do a number of policy-based initiatives and who have then gone on to have full-time jobs with Genetic Alliance after graduation. We have had, there was one, we have a graduate at the Association of Molecular Pathology. And we recently had someone come in and talk to our current students about the American Society of Human Genetics Public Health Genetics Policy Fellowship. So there are a lot of different kinds of opportunities out there. And our students are really trained to take positions in any of those organizations that I've talked about. Anyone want to add anything on the policy question that I forgot?
I believe you covered it.
Sounds good. All right. So the next question I've got here is, how competitive was it to get into your program?
Might be a better question for you,
That's,
Dr.
I know.
Durst. Because I don't know if we would know that.
That's true. That is true. So this tends to be a larger program and one that we have looked at growing over the years. We tend to get a very high caliber student applicant for the program with, different kinds of experiences. So there's not like one specific type of applicant that we're looking for, again, because the field is so vast. People can come in with all different kinds of backgrounds. And so I think that really opens it up to people with lots of different experiences. And so as a growing program, we've been very successful in doing that, and we'll just have to see where the future goes.
The application process is also not too difficult. It's like a personal statement and like 3 rec letters. They don't ask for GRE scores, so you don't have to worry about that. And there's no interviews. So that makes the process a little bit easier as well if you're considering.
There's also a lot of resources available prior to applying and prior to finding out, admissions. If you want to know more about specific admission requirements and that kind of thing.
Right. Now we have more of a general question here. So this audience member asks, if money is not an issue, what genetic disorder would you research and eventually want to give a treatment for?
It's a really difficult question
I
because all of
know.
them, do I have an unlimited lifespan too?
Let's go with yes. With unlimited money.
So that is really hard. Does anyone else have an idea? I personally am pretty personally touched by both mitochondrial disease, which is a very broad thing. There's many different mitochondrial diseases, but I'm pretty touched by that personally, as well as autism spectrum disorder. So maybe work with one of those two if money's not an issue. But there's many different diseases that would warrant being cured, of course, and treated and that kind of thing.
Yeah, Kit, I think you kind of hit the nail on the head there, in that there are so many conditions out there, and every person in the field maybe has been touched by a different one. And that's
Right.
Oftentimes what sparks some interest. Sometimes, not, sometimes it's something different as well. But we need more professionals out there to, have people to be working on looking into different treatments for different conditions.
Right. And there's also so many more conditions than I think any one person can really comprehend. Like when I started working with my organization for Tatten-Brown-Raman syndrome, I'd never heard of them. Only about 350 people are diagnosed at the moment. And we're doing a lot of work with diagnostic criteria and increasing diagnosis. So there's a lot of really ultra rare diseases out there that might not be as rare as they seem. And a lot of work to be done in health equity and that kind of thing to combat those. So there are so many.
Yeah, I think same for me. It's really hard to pick one disease. Like I mentioned earlier, I've always been really interested in neurodevelopmental diseases, specifically those that like impair learning and memory, just because like I feel like it really affects like children when they're trying to grow and develop. And so it can be really disheartening to see like children, especially like going through all these like learning challenges and like needing all these accommodations, sometimes even like having some physical disabilities as well. And so I would probably want to do something in that space, but I couldn't tell you a specific disease.
Go ahead, Krisha. Saw you unmuted.
I'm a little biased. I would say, again, like everyone was saying, it's so hard to pinpoint. However, my particular interest is in neurodegenerative diseases like ADLT, Parkinson's. Because I've been personally touched by that in my family. So that, but it is very hard to pinpoint. There are just so many that we have yet to discover and yet to touch upon and kind of figure that out.
I think for me, my brain immediately goes to things like Huntington's and Parkinson's, which are autosomal dominant. So really easy to get passed down. And, these are, life altering diagnoses. And there's, only so much you can do with a diagnosis of something like Huntington's. So I think diseases like that, which are a little bit of a death sentence, and those are really, really hard to, manage, and to the psychological impact of the diagnosis of those diseases is really intense. So I think if I had unlimited monies, that's what I would try and work on, is cures for diseases like that.
Yeah, I think for me, I agree with what everybody else has said, like all those different things. And then I was also thinking about like hereditary cancers and things like that. I know a lot of people close to me that have been diagnosed with rare cancers, hereditary cancers. And so that would be something, if I had unlimited money and unlimited lifespan, I would definitely want to do some research and try and treat those cancers.
Right, thank you all for sharing on that tough question. This next one goes back to the program. And so this audience member said that they heard there are additional, you said before, there are additional certificates at Pitt that can be supportive toward public health genetics or public health in general. And so if you all want to talk about what certificates have maybe stood out to you all, if anyone is doing or has done a certificate program, maybe talk about those ones. And again, I can kind of fill in the gaps as well.
I can start. I am doing the LGBTQ plus individuals health and wellness certificate. I've always had a passion for that community. I volunteered with Planned Parenthood in my undergrad and just absolutely loved it. So I'm doing that certificate. I'm starting the classes for it in the fall, so I don't have a lot of knowledge on it yet, but I'm really excited about all the classes that I'm able to take, a lot of electives and things like that. I'm also in a lab on campus doing it's not genetics, it's behavioral and community health science department, and we're doing research on putting together a training program for educating high school staff on how to better support their LGBTQ students. And so I'm kind of going to use that as, supplemental to my certificate as well. So that's one of the certificates that Pitt offers, and all the electives are super interesting. And yeah, I'm very excited to get into it in the fall.
Yeah, and I'm pursuing the health equity certificate, which is really cool. I pretty much applied for it as soon as I got here. So I started classes for it this past spring. And I took the overview of health equity class, which I really think is a really great class that honestly everybody should take. The professor is just amazing. Even though it's a 3-hour block class, but it doesn't feel like 3 hours, but it's just signs of a good professor, right? So I really like that class. It really taught me a lot about different types of barriers to health equity, which I feel I think generally most of us in the public health space are aware of the problems with health equity, but I think just seeing the different types and also kind of going into some of the history around it and how we've improved or where we need to grow toward, I think is really, really important. And yeah, I'm actually using part of my current internship for my health equity practicum. So similar to an MPH, you have to have a practicum for your certificate. And I think that those requirements kind of vary depending on what certificate you do. But like my certificate is just like it had to have some kind of health equity component. And so certainly rare disease advocacy is like right up there. So yeah, I'm really enjoying it so far.
Yeah, excellent. So there are a number of other certificates offered at Pitt as well. We've had a number of students in the past also do the global health certificate. And those three kind of combined that the students talked about and global health are the ones that I find that students in the public health genetics program often do the most often. But they are all summarized on the University of Pittsburgh School of Public Health website. So you can go and read more about them all there as well. They are all an additional 15 credits and have different requirements, as Vivian said. So, you know, some might be mostly coursework, some might have a practical component to them. That's going to vary based on the different certificate program. Right. So we've got just about probably 10 minutes left. Our time has gone so quickly. So I wanted to end with this question here, which is, what does public health genetics mean to each of you?
Public health genetics, what it means to me is being able to utilize the information and what you learn in subjects such as like molecular biology in order to increase or to reach out to the community and to further the education, be a resource for those in the community, these complex diseases, to further understand how they can take that information, apply it, and better their life for it and those around them.
For me, public health genetics it means to me like taking this giant, like previously misunderstood thing that is the human genome and using that information to create better healthcare, better community health in general, and just better understanding of our own health in relation to our genetics and how we can use that information to better our community overall. Which in a lot of ways leads to better health equity as well, because we can find individuals that might have been lost in the past, which is very important to me.
Yeah, I definitely agree with what Kit and Chriselle said. I think also I would add, for me, it's about educating the public on genetics and all these big, scary things that a lot of people don't know about, and just getting the word out there about your family health history and how important it is to know it and to screen for anything that might run in the family. And yeah, just like educating everybody on genetics.
To me, I think in a similar vein, public health genetics is really about education about genetics, because I think genetics can be like a really misunderstood field in general, and it's very complex, and you know, it can be really difficult to understand. So I really think it's important for people to have a better understanding of what genetics is, so it's not some scary huge thing that people associate with, you know, unethical medical practices and research, because I think a lot of times when you bring up the field of public health genetics, they just have these like sci-fi and popular culture things that pop into their head immediately. So I think combating that misinformation, because public health genetics is really such a great opportunity to intervene not only at the individual level, but at a family level and community level, for so many different health issues. And I think if people better understood like how important family history is, like just how much genetics plays a role in so many different parts of health, that I think we would have a much better system with much better outcomes for health and healthcare overall. So, yeah.
Yeah, no, I definitely agree with what everyone is saying. I think for me, public health genetics is about like taking genetics and like applying it to public health and like to improve community health across the board. And I think a big part of that is like just like increasing awareness and education about genetics. Genetics is complex. It's not an easy science, and definitely like not to the typical, general public. They wouldn't necessarily know the most about genetics, which is why, there's certainly a field for public health and genetics. And so I think it's really important in this field that we're just like keeping up with genetics, but also ensuring that the communities that we're serving also understand how important genetics is for improving public health. And also, like Kit mentioned, like advancing health equity as well. There are certainly a lot of barriers within public health and within the healthcare system. And so genetics can definitely bridge some of those gaps in healthcare.
Wonderful. Thank you all for sharing tonight. We do have actually a couple more minutes left than I thought. So if anyone has any closing comments, we can go ahead and do that. And then I wanted to, I'll offer some closing comments of my own.
I definitely think I feel very fortunate to be able to be a part of not only the Pitt community, but also to be able to potentially be a leader in the public health genetics community. There are so many things that we have yet to learn more about, and genetics and public health in both of those. It's such a wonderful field, and it's so wide reaching, and so there's so many potentials out there to really make a difference in communities, and just feel very fortunate to be here.
Yeah, I definitely agree with Chriselle. I think our Pitt community of public health genetic students is incredible. I've gotten so close to all of my classmates, and it's so wonderful. I don't know how I would have gotten through the first year without everybody's support, and not only just our classmates, but program leadership like Andrea and the rest of the human genetics department, and just the school of public health as a whole. I did not really know that this field even existed prior to looking into it and kind of stumbling upon it. And it's been really, I've learned so much. I found a huge passion for public health genetics and genomics, and very excited to see where my life goes in it and where all of us go and where the field goes. It's very exciting.
I think Chriselle said it really well earlier when we were talking about public health genetics, but this field is really a choose your own adventure. There is so much opportunity, and the things that you can do in public health genetics are so varied, and you can really, like, if you have a passion for genetics and you want to see that in a career, you can make that happen for yourself through this field, because also kind of how we touched on earlier, this is a very new field in general. So it's an exciting time to be in public health genetics and genomics right now, because the field really is exploding, and there's so much research and so much innovation going on right now in the just realm of genetics. And I think there's going to be so much opportunity in the next few years to really see how genetics becomes more, like, genetic healthcare becomes more widespread, and public health genetics just becomes ubiquitous. So I think it's really exciting.
Yeah. And just going off of that, like you also don't have to enter the program already knowing what your interests are. Definitely it's something that like I was kind of figuring out as I was going. Like I didn't realize until I was doing cancer research that I was like, maybe I don't like love working in cancer that much. It was a great learning experience, but probably not something that I want to do super long term. But then I found like another opportunity in rare diseases where I get to work with more like pediatric populations, and I'm enjoying that a lot better. And so definitely like whenever you enter this field or this program, there are a lot of opportunities, but like don't be afraid to like explore different ones. So yeah.
Yeah, and I agree with that too, Vivian. There's so many different opportunities and so many different resources, and it's not like you have to pick one thing you're interested in either, because all of these things work so well together. And I found kind of throughout my time that I kind of, like you were saying, Chriselle, kind of like built what I wanted to do from different pieces that I learned and things that I found I was interested in. So I agree, it's a really exciting time to be in public health genetics, and I'm so happy to be and so grateful to be a part of it so early on and to get to see how it evolves.
Well, thank you all for being a part of the panel tonight and for sharing your perspectives as students and recent grads in the field of public health genetics. I did just want to mention that obviously we are all from the University of Pittsburgh, but the students mentioned the other programs that are available out there. And I think many of the things that they talked about tonight would be kind of universal across programs. Obviously, there are some things that are specific to the University of Pittsburgh, but things like career options and practicum opportunities and those sorts of things, you're going to probably find at many of the public health genetics programs. And so I encourage you, if you're interested in this field, please reach out to us. I can be found on the Pitt Public Health website. Please reach out to the other programs. Faculty members are always happy to talk to interested prospective students. And you know, we would love to hear from you all in the future. So thank you to our audience who joined us for the live stream tonight. And if you're watching this on video recording, thank you for watching this later. We hope that everyone is able to join some of the other Public Health Genetics Week events this week. There are a number of things scheduled. You can find that on PHGW.org. That's linked, I think, in all of our in all of the students' backgrounds here, so you can see that. And yeah, have a great week, everyone. Thank you so much for joining us.